The cookies were good. I baked them myself. No. My name is Peg Fulton. I grew up on a farm in Story County, Iowa. Now live only 22 miles away from the farm that I grew up on. I'm here to talk to you today about my experiences as a hospice care provider. I'm an RN. I've been an RN for over 20 years, and I am a board-certified hospice and palliative care nurse. I also want you to know that I am a godless atheist. I recovered from being a Southern Baptist about 10 years ago, and it's almost like this is an AA meeting, and it has, it has been almost 9 years since the last time I said the Lord's Prayer. But hospice itself is so steeped in religious traditions and superstitions. As a non-believer, this has been a wild ride, navigating with people through their end-of-life journey, whether they have been devout believers, whether they have embraced non-traditional religions, or no belief at all. Each one of them has had a very unique experience to the end of their life. I hope through some information on hospice and through my sharing of some of my caregiver stories, I can connect with our theme of our conference this afternoon on the death and dying beyond belief. First off, I wanted to share with you a little bit about hospice, and this is just hospice in a nutshell here. We've already heard that hospice is offered to people who have a terminal diagnosis. That means that all the tests are in, folks, and it looks like you've only got 6 months left. You may wonder why hospice care is even offered as an option. Well, the care that needs to be provided to those at the end of their life is different than the care that is provided just in a regular hospital setting. The care that is required needs to be specialized. There are special needs that the dying patient has. The normal medical system doesn't know how to handle those ends of life situations. You talk about having those hard conversations. Having to be in that hospital room with all my hospice paperwork ready to sign up my patient for hospice care, and to have the doctor go, well, the reason she's here is you're gonna die. I'll let you take over. Doctors aren't trained in how to handle end of life. They're trained how to actively intervene to prolong life. That's why hospice is so important. It allows people in that last 6 months of their life to make decisions, have the conversations that they need to have. The focus is comfort, physical comfort, emotional comfort, and for some people, spiritual comfort. Hospice is not denial of care. Everyone's heard the story about, well, dear Aunt, so-and-so's dear Aunt Minnie went to the hospice house and they just decided that they weren't going to treat her anymore. In fact, part of comfort in some patients' hospice care is treatment. Conditions such as urinary tract infections, wounds, shortness of breath, and even depression can actively still be treated with a patient that is under hospice care. Hospice isn't assisted suicide. I know that side. People are terrified of suicide. Some caregivers, I've worked with nurses that have been doing hospice for almost since the first day of hospice. Some of these nurses still refuse to give morphine because of the fear that it will hasten the death. The reality is, it's not the medication that's going to cause the patient to die. It's their terminal disease. It is their terminal illness. It's the complications of that terminal illness that is going to cause that final demise, not administering the pain medication that's going to take away the suffering. Some people feel that hospice is abandoning all hope. And we've all heard it. We've all been present at those conversations where someone said, well, we went through all the chemo. I guess there's no more hope. We're going to go to hospice now. Hospice isn't the abandonment of hope, it's the rerouting of hope. I can't say that enough. It's instead of hoping for a cure, it's hope for relief of pain and suffering. Hope for relief of symptoms. Stopping the painful treatments that have debilitating side effects, and being able to, instead of sitting in the infusion room in the oncology unit, you're sitting on the dock fishing with your grandchildren. That's the rerouting of hope that you can have with hospice care. Hospice has a multidisciplinary approach to the patient's care. Doctors, nurses, nurses' aides all work together hand in hand with social workers and chaplains to develop a very unique patient-centered plan of treatment that is unique for each different hospice patient. That patient is assessed on a daily basis, sometimes even on an hourly or minute-to-minute basis, to make sure that that care plan stays relevant, that it remains effective. In fact, Medicare mandates that at a bare minimum, a hospice patient's plan of care is evaluated by every individual on that hospice care team at least every 14 days. At least every 14 days. So, I mean, with the government thinks it's important enough to mandate that, and that drives the payment for the hospice, you know that it's going to be getting done. You know, the other thing that I find is neat about hospice is that it's not just the physical symptoms and the relief of those symptoms that, as a nurse at the bedside, I assessed my patient for. It's also those unspoken needs. The social workers help focus on planning for the death, the reduction of anxiety through open discussions, the anticipating of the grief to come, and the preparation for that. The number one goal is helping the patient achieve a good end or a good death. When we would give a report from one shift to the other, in the hospice house and we heard that someone had died in the hospice house, we would ask, was it a good death? That became, I guess, if you want to look at it, the benchmark for our success. Was it a good death? Was it a good death? What does that good death mean? It's different for every single person. For every single person. For some, it may mean dying without pain. For some, dying without fear. For some, it's simply being warm and feeling loved. For others, it's being able to cross everything off that bucket list. Hospice care, I cannot stress this enough, needs to be provided as soon as possible. There needs to be an urgency to deliver hospice care, just like there is an urgency to get somebody to the emergency room. Those 6 months, those last days of a person's life are precious. They are a gift. When our 20-year-old youngest daughter passed away 2 years ago, she passed away very suddenly, and we did not have that gift of preparing for her death and being able to say goodbye. Hospice provides that beautiful gift to families at that end of life. I wanted to share with you some of my experiences in dealing with patients. Some of these are kind of tragic. Some of them are really kind of neat. I hope you enjoy them. I love to tell stories. So, I dealt with a very religious family. The mom was losing her battle with breast cancer. And this family loved her. She was the matriarch of this family. And her family were at her bedside. They had hymns quietly playing on the CD player, and they were reading scripture to her. And those of us on the hospice staff could see that the family was not acknowledging that mom was dying. We wanted to gently and respectfully shift this family into reality. I was working with them one evening and I knew that they believed in healing, and asked them if they would be willing to accept the possibility that healing would not come for their mother in this life. The family was just terrified. They were like, we can't talk about dying because mom's going to lose all hope. We can't have mom lose all hope. In fact, the oldest son was just panic-stricken and said, don't talk about this. We can't have mom lose all hope. Well, the patient heard her son's remark. And in her best mama voice, she gets up and props herself up in her hospital bed and she says, "Oh, honey, don't you know that my hope comes from Jesus? Death isn't going to take that away." And then she proceeds to start to sing, "My hope is built on nothing less than Jesus' blood and righteousness." And like that, this hopeless fear that this family had was changed into a beautiful, joyous time. The focus was immediately shifted from praying for healing to that joy in the release of suffering. Hope for mom in getting to be with the Jesus that she believed in. and the patient died with her family around her bed. It was peaceful, it was loving, and it was without fear. By the hospice staff respecting the religious views of that family and creatively redirecting their religious metaphors and their religious beliefs brought hope, peace, and joy to that family. I have taken care of very religious families. There was this one family that, they were like uber religious. I mean, when you walked in the room, this hand came out and slapped you on the head with oil on it, and they were going to anoint you. And they were going to cast out any negative or evil that you brought in with you. I mean, it was pretty embarrassing. But only positive words could be spoken in that treatment room. The word death was not allowed. The patient's pastor, and unfortunately, the hospice chaplain, interfered with the family being able to prepare for the coming death. They were not able to say goodbye to this patient. They wouldn't even allow the social worker to help them choose a funeral home. As a result, the patient's death was horrifically traumatic. Doubt, anger, shouting, and shock accompanied this patient's last breath. She wasn't supposed to die. God was supposed to heal her. The family was in total despair, and they never got a chance to say goodbye. That was not a good death. One of the things I think is horrifically heartbreaking is having to hand out the Kleenex to the pastor in that situation. But that's another story. I will tell you that being a hospice nurse requires active compassion. Kindness is an essential element in hospice care. I've learned that kindness and compassion don't always flow from caregiver to patient. Sometimes it flows from the patient to the caregiver. I had the privilege of taking care of a patient who was Buddhist and raised in Nepal. And this guy was so cool. We loved taking care of him. You would walk into his room, and there was just such a peace and a serenity. And meditation was tremendously important to him and his self-care. He liked to say in his very broken English, "Meditation is my medication," which we loved him. And you know, we saw how meditation had worked to relieve his pain and to relieve his anxiety. And we thought, we're going to ask him how to do that. And he had no qualms at all about holding a meditation lesson. He goes, "This is how you meditate." He shared, concentrate on what is most meaningful, the most meaningful place, what your meaningful purpose is. Now, he's saying this to a group of nurses, okay? We all said that idea seemed too hard to grasp. He said, maybe your most meaningful place is right here. Your most meaningful purpose is to be right here, right now. And I thought, bam, this guy, he definitely put a point on this. Most meaningful didn't need to be the biggest, just the most valued at this present moment. Suddenly, it was all so simple. We expressed to him our gratitude. I cannot tell you how humbling it was for the nurses to be cared for by this patient. We all thanked him for his teaching, and he died just 2 hours after our impromptu meditation session. He had a life of usefulness and service to others to the very end. His life made his death meaningful to all around him. That was a good death. Because you know, the truth is, our life and the relationships within our life are setting the stage for a good death. I want to tell you something that you may not know. None of us are going to get out of this alive. Being born is a death sentence. Okay? Again, it's our life and our relationships that set the stage for that good death. My final story is about an atheist mom. I loved this woman. I just loved her. She was a lifelong atheist. She had devoted her life to loving her children and to serving her community and others. She had lost her husband several years before, and the only living family member she had was her daughter. She knew that the ovarian cancer was going to take her life, but she was totally prepared. She had covered all of the details. Who would take care of her dog? For her, it was going to be cremation, not burial. I'm not going to use some land that somebody could grow food on, okay? No funeral. She wanted just a really nice dinner party with good food, good friends, and good wine. Put my ashes at the end of the table, she said, and make sure my plate and my glass are full. That's what I want. No flowers, please. Just give the money to Planned Parenthood instead. When the time grew short and she was actively dying, she asked me, "Peggy, can you call my daughter?" When the daughter arrived and was at her bedside, they just sat next to each other, just absorbing each other's presence and telling each other how much they loved each other. The mother said, "I have a question to ask." And she said, "Peggy, this one question, I just can't quite come up with the answer." And she paused and said, "What will be left of me when I die?" Well, I tell you, I took a deep breath. I took several of them. And I saw the daughter looking at her mother. And suddenly, I knew. It was so cool. I knew. I took the mother's hand, and I took the daughter's hand, and I placed the mother's hand in the daughter's hand, and I said, "This is what will be left of you when you die." And the mother, being a very practical, pragmatic woman, looks at her daughter and says, "Oh, that's enough. That is enough." Hers was a good death. Thanks.